Welcome to Orthodontic Smiles, the podcast designed for all dentists and their staffs who practice orthodontics. This podcast is brought to you by the American Orthodontic Society. This week on Orthodontic Smiles podcast, we will interview an associate instructor of the American Orthodontic Society. It is often said there is no I in team. Building an effective team, a team with no I, is what we all want in our dental and pediatric practices. There are so many benefits to that. The doctor has less stress, there's more productivity, and there's happier patients and staff. Adding a new modality, such as orthodontics, to your practice can sometimes make the team a little shaky. It's all new. Everything's new. Our guest today on Orthodontic Smiles podcast will help you get through this transition. She's an educator of dental assistants and hygienist in the fine art of orthodontic dental assisting. She has done this for over 10 years. Coming from many years of personal experience, she is gifted with her unique teaching style and philosophy. In the American Orthodontic Society, we know her as our team builder. She is none other than Susan Coffey. Orthodontic Smiles podcast wants to welcome this evening Miss Susan Coffey. You might not know Susan Coffey, but she has been around the American Orthodontic Society for almost 10 years. And she is one of our associate instructors, and she is in charge of the program that teaches dental assistants how to assist in an orthodontic practice. We've always said in the American Orthodontic Society that to have a functional orthodontic program within your GP or pediatric practice, that you needed to have educated and very competent dental assistants. And Susan is that person for the American Orthodontic Society that has trained hundreds of dental assistants in orthodontics. So welcome, Susan Coffey, to Orthodontic Smiles podcast.
Thank you. Thank you so much for having me. I'm grateful that you asked me to do this.
Well, good. It'll be fun, and we'll just talk about how you got started in this and what you do for these young people that come in and want to learn orthodontics. So how'd you get started in orthodontics? You know, most dental assistants, they work in dental practices, but not necessarily confining themselves to an orthodontic practice. So how'd you get started in orthodontics?
Well, it was a really strange situation. I worked in corporate America, and company got bought, and so I was hanging around the house, and a friend said, "Hey, why don't you come work in the dental office with me?" And I thought I would try small business. Why not? So I was hired to do front desk and scheduling, insurance, and I thought, I can do this. I can handle that. Well, I was there about 2 weeks, and an assistant abruptly left from the back. And the doctor in the orthodontist office, that's where I first started.
Oh, you actually started in an orthodontic office?
I did. I actually started in an orthodontist office. And he said, "I need you to come assist me." And I thought, oh, wow, okay. Other duties as assigned. I think I can handle this. So I went to the back and started assisting and absolutely fell in love with it. He had a very well-trained assistant that had worked for him for over 10 years. And she was my mentor, and she was great. She explained everything, and I absolutely loved the process. And I loved the relationship with the patients. And I did that for many years, probably about 4.5 years. And then I took some time off. My son was graduating high school, and decided that I would spend some time with him. And after that year was done, I decided I needed to go back to work. And that's how I came and met Dr. David Jackson and walked into his office that had orthodontics splattered across the front door. So went in and he hired me, and to my surprise, he was a GP. And I was like, what are you doing? Is this possible? I had no idea that GP could do orthodontics. Well, he absolutely won me over with his philosophy and teaching. And that's where my experience with GP came into my life. And then, of course, David Jackson teaching doctors is how I got into the assisting.
Well, he won me over too. As you know, he was one of my best friends, and unfortunately he passed. But my heart still remembers the days that we taught together all over the country, and went to programs and courses and things like that. So he was quite the guy, as you well know.
One of a kind.
You never knew what was going to come out of his mouth, nor what he was going to do. And he was. I remember him asking me one day, Ed, what do you think about me putting a sign up that says I am the singing dentist? And you're laughing too.
I am laughing.
Because it's true.
It is true, and he had it.
No, I'm not sure that I would do that, Dave, but he thought that was the greatest thing in the world, so he put billboards all over town saying that he was the singing dentist. Well, he really was the singing dentist. He had a great voice and very often would spontaneously sing. So I knew you would you'd have a great time working for him for sure. So
Absolutely.
I know he taught you a lot before you even got started. So how did you fit into his practice and what he did getting ready for these courses that he was teaching?
Well, after I was assisting him with a couple of other assistants in his courses when he was teaching the doctors.
But in the office, I mean, did you help him prepare for the courses? Was that part of your duties?
Absolutely. With we documented everything. So the documentation process is so important, especially for those doctors who are wanting to teach and credential. Very important to document. So that was very heavily put on the assistants to be able to get the diagnostic records and get all of that. But to actually prepare and set up for the actual courses, we were very involved in that. And after about a year, he said, what do you think about doing an assistant course? He says, I think that would be really important. I said, I think that's very important. I think you should do that. And he goes, well, I think you should teach it. And I said, yeah, I don't think so. Not a good idea. And he goes, no, you talk about what you know, and it's going to be great. So he truly encouraged me to start the assistant program alongside his teaching modality. And that's when it just blossomed, and it just really, really grew our relationship. So we were able to be doctor and assistant in the office. And then that evolved into teacher and assistant teacher in the classroom with the doctors.
Now, you helped him with his courses when he was teaching.
Absolutely.
And when he was teaching actually to the students themselves. And
Yes.
there are exercises that have to be done during that educational process. And so you were involved in helping the doctors learn the specifics of doing the mechanical part of the orthodontics.
Absolutely. Walk around the room and help them do their hands-on portion, answer their questions. He also had an in-office program for a few years that doctors came back to the office and worked on patients and banded and bracketed them and changed their wires. And it was a 6-month course.
Yeah, that was the premier course. That was a pretty extensive course, actually. And you treated the patient from beginning to end. And,
Absolutely.
And that was pretty unique for its time, because the doctors came from all over the country and came, what was it, every 3 months or so, and actually would
Yeah, we did about every 6 to 8 weeks. We tried to do that and get them to come in and see the patients. Um,
In the
it
meantime, he
was
was seeing the patients in his office on a monthly
absolutely,
basis, but they
we
got a
did.
chance to see the way the treatment was functioning.
Absolutely. And they were part of the treatment planning process as well at the very beginning to show the doctors how to treatment plan and how are we going to proceed with a particular case. And whether it was phase 1 or phase 2. So it was very hands on and it was very intense. And I was heavily involved in getting that prepared, especially for those clinical Saturdays. So that's where a lot of doctors, we had a 100% success rate that every doctor that went through that class started ortho patients in their office. That's the scariest thing for these doctors is starting the ortho. They go to class, they learn, they send their assistants, and then they go back to the office and they kind of go, okay, what do we do now? And they have this fear of just jumping off that ledge and getting started.
Well, it's a long-term commitment, and no one,
It
if
is.
you're a little bit apprehensive about new things, I totally understand it's a long-term commitment. You know, we all were that way. I mean, every one of us. Dave was like that. I was like that when we started, and I've been doing this for 40 years. But what's so interesting about it is that it's a leap of faith that you take. But the problem is that there are people in the American Orthodontic Society that stand behind you all the way. It's not like you're just
Yes.
being asked to do this without anybody helping you. This is
Correct.
you know, you come every 6 to 8 weeks, and there's somebody there to help you out and help you know what's going to happen next and things like that. So I understand. Many times I would put a spring on, and the assistants don't have to worry about this too much, but the doctor does. You'd put
Sure
a
they do.
spring on, and you'd say, wow, I wonder how far that's going to move that tooth. And then you'd say, did I put it too much pressure?
Right.
And you worry about it. And about 2 days later, you have the front desk call the patient and say, could you come in
Absolutely.
a week
I just want to
later?
see what I've done.
I just want to see how much it's moved in a week.
Absolutely. And make sure that I didn't open up, twice as much as I needed.
Exactly. And so that happens to all of us, and you shouldn't be ashamed of that, but it's a leap of faith that all of us take when we're doing orthodontics. And if you don't think it happens to the ROs, the real orthodontists, it happens to them as well. You know, the only
Absolutely.
difference is they're in an educational program where everybody's there every day, and if there's a problem, you've got somebody at hand to be able to help you out of it. But
Absolutely.
we do the same thing. I mean, we have mentors in the American Orthodontic Society that if you have a problem, nowadays it's much, much easier, Susan, because we have the opportunity now to take a picture of it with our phone and send it to our mentor and say, look, this is what's happened. What should I
Real
do?
time. Absolutely.
You know,
That makes a huge difference.
yeah, Dave was always on the phone with so many of his students, just following up on this whole process of teaching, and he was a great teacher. I got to give him credit. I just didn't have the I would weigh one thing. I would say, do I want to teach 13 weeks a year, or do I want to
Right.
go down to the beach and stay at my beach house? You know, and I'd weigh the two things, and I'd say, I think the beach house sounds better. But
Absolutely.
David was
He committed.
David was a performer, and he
Yes.
loved the opportunity to be in front of a class and teaching what he knows, and passionately taught it for many, many years.
Yes.
And God bless him. He was a close friend, and I know a friend of yours as well.
Absolutely. One of a kind. And I was going to say that's exactly what his mentality was if you were a doctor that came through his course, when you finished the course, he wasn't done with you. You still could call. He was still your mentor. He was still there for you and wanted to see you succeed. And that's why when Dr. Williams took over Dr. Jackson's classes, he was so like-minded in that manner that he does the same thing.
And
The
Brad
AOS
has done so well with the
Yes.
courses. I mean, he has really, I gotta say, he's really done very, very well. in
He
such a
has.
short period of time.
He has, and I'm so proud of, being there with him along this way and being able to see the progress. And I think one of the biggest things with Dr. Williams is he is a actively practicing GP doing orthodontics. And he relates to all of those students so well of what their capabilities are and
how they
and what they
integrate
could
it
be
into
doing.
a practice. That's so
Absolutely.
often I get phone calls with the students that I teach. They say, how do I integrate this into my practice? I know how to do this, but what do I do? How do I stop seeing one kind of patient and start seeing another kind of patient? And I said,
Right.
just do it. You'll figure it out. It's not that difficult. I said, when one patient needs to be seen, you put them in the slot, you do it. I love the opportunity to have my orthodontic patients come in the midst of my day, because since I'm a pediatric dentist, I'm seeing 2 and 3-year-olds, and to have a 7, 8, 9, 10, or 13-year-old come in that's in brackets and needing care, it's kind of a break in my day.
Sure.
To be able to get my mind off of the 3-year-old and onto some orthodontics. And it's refreshing. Let's just say that. It's refreshing, and it's not as intense as doing 4 crowns on a 2 or a 3-year-old.
Correct. And that's the biggest thing is a lot of these doctors will, I don't know if I can do this. I'm like, you can do this. And like you said, and at the risk of sounding like an advertisement, just do it. Because you do so much more difficult things in your office every day that ortho is the least of your worries and the easiest to do. And you can have so much fun doing it that you can do this. And so just to give them the little pep talk that says you can do this, you should be doing this. And I tell, like yourself, pedo doctors, if you are pedo, you should be doing ortho. It is self-contained. You don't even have to market. You just say I'm doing braces, and you've already got your marketing field right there.
Well, it's more than that. It's you have a service to offer your patients.
Absolutely.
If you're in pediatric dentistry and you're seeing these patients every 6 months, that's the beautiful thing about pediatric dentistry is that every time you see that patient, they're a different patient. Mm-hmm. They've grown. Things have changed.
Absolutely.
Things have gotten better. Things have gotten worse. You're in a most unique position to be able to see what happens to that young child from the age of, 18 months to 6, 7, 8, 13 years old.
Absolutely.
What a wonderful position you're in to be able to offer a service for that child. I would hope that someone would do that if I had a child. And
absolutely. I mean, to be able to catch anything so early and to correct any cross bites or any issues that are going on.
It's learnable. If you didn't,
Absolutely.
You know what the name of my course is, Susan? What you should have learned when you were in dental school. And
absolutely. I love it.
They just don't. I don't know if they just purposely don't teach it or just don't have enough time in the day to teach it. But what you should have learned is what these children need the most, the growth and development. And now we know so much more about pediatric sleep apnea and nasal obstructions and the life that literally we can save as a result of how we diagnose patients in our offices.
And it's such a hot topic, the airway.
Oh, my goodness, yes.
So hot.
It is a real hot topic right now, and that's for sure. And the pediatricians are now starting to buy onto it, and the pediatric pulmonologists are buying onto it. And so it's something that we need to learn as pediatric dentists, and that's what I have a course coming up in November that's starting, and we're putting that a lot of emphasis on that. I think that's one of the most important things. So why do you like teaching orthodontics? Is it something that's have you taught before other subjects?
No. And so that was the craziest thing when Dr. Jackson said, well, I want to do an assistant course and I want you to teach it. I went, yeah, that's not me. And to this day, I still get nerves before I get in front of a class. But
you were a little nervous when I asked you to come on Orthodontic Smiles podcast.
Absolutely,
I heard
was.
that little quiver in your voice. And I said, no, you could do this. This is really fun to do.
So before every single teaching session, Dr. Jackson is in my head to this day. And he said, Susan, just talk about what you know and you will do fine. Talk about what you love and you will do fine. And it's very true. Once I get started and I start talking about ortho, I've had my students come back and tell me, oh my gosh, I can just tell how much you love ortho. And it's not just the concept. I'm a type A, so the millimeters matter to me. And I'm a puzzle solver, so I like the idea of trying to figure out how to fix a situation. So I really love that. But what I didn't anticipate was seeing these patients on a monthly basis and falling in love with them and seeing them absolutely change their behavior when they would cover their mouth, when they would smile or speak. Or I take initial records on one little girl and I tell her to smile and she cries because she doesn't like to smile.
Right.
But to see her at the end of treatment with the most beautiful smile and the brightest personality, it's just amazing to see the transformation in those patients. And so I absolutely fell in love with that portion, and I didn't expect that.
Yeah, dental assistants don't, we don't think often about that relationship that the dental assistant has with the patient. I'll give you a perfect example. I had one of my dental assistants a month ago. Happened to mention to one of my Hispanic young ladies that was undergoing some ortho. She said how much she loved Spanish food or Mexican food. And this past month, yesterday actually, the little girl came into the office. She's about 12, and she came into the office with a big bag of tamales. And she gave it to the assistant. She didn't give it to me. She didn't give it to the other student. She gave it to the assistant, and because she said that she loved Mexican food. And so that relationship is wonderful, I think, between the assistant and the patient. So
Absolutely.
I think it's something that we don't think of very often, but dental assistants need to know that they make a difference as well. It's not just the doctor that's making a difference in people's lives and how they affect them. So you obviously feel like this orthodontic knowledge is something that's important for dental assistants to have. Absolutely.
One of the biggest things that we believe in, AOS, Dr. Williams and myself in our courses, is cross-training. You've got to have cross-training in your office. And so we really believe we've got a lot of offices that are wanting to incorporate their hygienist into the ortho. Especially in pedo practices where the hygienist is cleaning their teeth, but then they go into removing the wire to clean their teeth and then replacing the wire or putting a new wire in. And so they're getting the ortho training, which is a nice break in their day as well. But it's very time saver. It's a great time saver. And not having to transfer your patient to another assistant in another dental operatory and dirty up that room. The hygienist is kind of streamlining and doing all of that. And so a lot of offices are looking at that. So that's some great cross training there. So a lot of hygienists are in my courses along with general dental assistants.
Well, you know what? You talk about time saving. You talk to a parent who's got their child in treatment with another orthodontist, and they have to go over to the orthodontist, get the wire out, come over to the general dentist or pediatric dentist's office, have their teeth cleaned, then go back to the orthodontist to have the wire put on. If the doctor that's been trained by the AOS is doing the orthodontics, that's all can be done in one office, and don't you think that's not desirable?
Absolutely.
For the parent. And I am absolutely a proponent of cross-training. Every one of my dental assistants can do everything the other one can do. And I'm talking about from bracketing to wire changes to everything that is done, records, photographs, everything. is done by each and every one of them. So we don't have to worry about which chair or which assistant is free when something needs to be done.
Yes, I love that. Great proponent of that. I absolutely love and support that 100%. And I try and teach the doctors that, because the one thing when they start ortho in their office, it can become sometimes I call it a big hairy beast. It just kind of can take over because you already have the patient base established. They love you. They're coming to see you anyways. And so you kind of get the ball rolling, and the scheduling is kind of all on its own. So you need to have somebody who's specialized with that, kind of like your hygiene. You've got a hygiene coordinator. You might want to have an ortho coordinator, but it takes over your entire office. And so your entire team needs to be aware, from filing insurance to billing to scheduling to actually seeing the patients. It is your entire staff that gets involved when a doctor takes on the orthodontic revenue source. So
absolutely, and in preparing for this podcast, I know I've talked to you about one of the things that really strikingly affects you being an assistant, and that is doing special needs patients.
Absolutely, that is. I would give Dr. Jackson a hard time with that, because he would take on cases, and as the orthodontic assistant, we primarily would see these patients and do most of their work changing their wires. And so we would know that certain patients we need to schedule a little bit of extra time with, and we gladly did that. I gladly sat for 20 minutes talking to certain patients until we were ready to get to work. And being able to build those relationships, tease them, give them a hard time, laugh with them, cry with them, be happy and be mad with them. They go through every emotion in the book when they come through through your chair, that they just learn to trust you. And it's a great relationship that I have
total
hold near and
empathy
dear
with you. I mean, I see a great number of special needs patients in a pediatric practice, and have been doing orthodontics on them for years. There are some that just, unfortunately, it's very difficult to do, but there are most of them, if you have the patience and the time, they do fine with the treatment, and the parents so appreciate it. It's so appreciated. And
sometimes it's even compromised, but that's okay, because you've made them feel better about themselves.
Absolutely, it's not going to be your very best orthodontic case in most cases, but boy, it does make them look better and makes the parents happy, and the kids are much happier as a result of it. No question about it. It's a wonderful thing to be able to provide. And I know you feel very strongly about that. That's very nice. So, this whole thing about assistants doing orthodontics as a very special difference in what they're normally used to doing. But is this part of continuing education, what you would call continuing education for the dental assistant?
Absolutely. I think that there should be a way that you progress to a specialized area, and ortho would definitely be that. The going through your continuing education, not only are you staying relevant and seeing new technologies, but when you're in these courses, you not only learn from the instructor, you're learning from other students in the class. And that's one thing I like to bring to the table with my classes, is open discussion. And, well, how do you do a certain technique in your office? And so we learn from each other. And I still learn from some of my students, some of the things that they do. So continuing education, I think when you get them out of an office and you get them in a situation, and unfortunately sometimes away from their bosses, they have the freedom to ask some more questions without feeling lesser than or embarrassed by their questions, because we're all RDAs in this room. And they might ask me or another student sitting next to them questions that they may not ask their boss or their doctor. And so I think it's a little bit more freeing for them, and we learn a lot more in these continuing education classes when we take a step out of the office, and when you do it as a team especially. So that's something that Dr. Williams has really wanted to incorporate in his whole process, is not just train the doctors, and let's not just train the assistants and the hygienist. Let's train the entire staff. So along with incorporating assistants training, he has created a one-day managing orthodontics program that his office managers teach. And it is unbelievable. They discuss fees, filing insurance claim, coding, scheduling, collections, so much more, that if you're going to start and do ortho in your practice, you need to know how to file those insurance claims correctly.
Absolutely.
And get paid for the work that you're doing.
Yeah.
A lot of GP will do work that is they can get paid for, but they just throw it in as ortho.
One of the things that I teach in part of my course is the actual consultation with the parent.
Yes.
Because there's, I mean, when you really look right at it, we're actually providing a sales of orthodontics.
Yes.
We're helping the parent understand what they're getting for their money and how we're going to do this and what the problem is and how we're going to solve the problem and how you're going to pay for it and how we're going to provide a service for your child. And that, if that isn't sales, I don't know what is. So doing a consultation needs to incorporate all of those different aspects of what you're going to provide for the patient. Otherwise, they don't understand it. If they walk out of that office without understanding what you're going to do for their child, then you've not, all the knowledge you have about orthodontics is for naught.
I completely agree. And that's one of the things that, like anything in dentistry, they hear it, multiple times by the time they leave. And so one of the things that I like to discuss with the hygienist and the assistants is what to look for. What are we looking for that is saying, little Johnny here needs, might need some work done in the future. But like you mentioned earlier, you're seeing these patients since, when they're so young.
They're very young, yeah.
And you're seeing them every 6 months, every year. And so you're going to be able to say, they're doing good. Let's just wait. Nope, they're doing good. Let's wait. And now when there's an issue that we need to fix, they're going to trust you on that.
Absolutely.
And when your assistant and your hygienist and everybody is backing everybody up in the office, it makes that consultation or that sales pitch a little bit easier.
Susan, when you're teaching in Brad Williams' course, who's our premier instructor for American Orthodontic Society, when does he bring you in for the teaching of the assistants?
Great question. So we feel the last session of his 5-session courses is the best, especially with his basic. These are brand new doctors that are just putting their toe in the water. They're just wanting to see if this is something that they want to do. And so by the 5th session, so almost 6 months in, they pretty much have an idea if this is something they're going to pursue, which we also encourage throughout those 5 sessions to take records and start ortho cases. Because once you start during those class, Dr. Williams on his Sunday mornings does case reviews. So you can have your mentors and your fellow classmates go over treatment planning and help you with that. And just to chase a little rabbit here, they also get to come back the second year and monitor the following year at no charge. So that's 2 years worth. So that's almost an ortho case that you've had someone right by your side walking along with that.
Yeah, because sometimes a case will take longer than a year to treat,
Absolutely.
and you want some follow up, and Brad Williams is there to follow up with you.
Yes.
Susan, so that is one of the remarkable things about the way we teach in the American Orthodontic Society. It's very comprehensive, and it's very, very, from start to finish, it's very intricate in the way it's taught. It's been done this way for many, many, many years,
Yes.
all the way back to Bill Wyatt and Bob Garrity, and even before that. And so it's tried and true, and Dave Jackson brought it to the next level, and he brought you along. And so I really, respect you for the number of people that you've taught over the years, and how well you've done this educational process for assistants. But,
Well, thank you.
sometimes you just can't get it all. You can't get it all in the class. And I think
Right.
what you've started by having a consulting service that actually goes into the office and
Yes.
helps the assistant and the doctor implement orthodontics into their practice is great. Tell us a little bit about that.
Well, thank you for asking. Actually, that's something that Dr. Williams and I discussed, because we wanted somebody or something that would make sure these doctors were successful. They spend a lot of time, a lot of money, a lot of time away from their office and their family when they come to these courses. And when they invest their time coming to these courses, and then on those fifth session, we make it that team event by inviting the assistants and the hygienist along with front staff for that management training on that fifth session. Then when they leave on that fifth session, they go back to the office, and some doctors kind of go, what do we do now? Because one of the things they do is they set up their office. So they, through OrthoArch, which is a company that helps supplies and supports the GP doctor and Dr. Williams, they set up their office. And so they go back to their office and they start receiving all of this orthodontic supplies that they've set up with. And they're like, they don't really know what to do with that. So Dr. Williams and I thought, well, why don't I go to their office and help them for those that want that? So I help incorporate the hygienist into the vision. How do they integrate their GP schedule and appointments with ortho? And we kind of figure that out. I help them try to market, internal and external marketing. I touch on that a little bit. But to really streamline and use time management with ortho, it's so new to them. And one of the biggest things I can tell them is give yourself a little bit of extra time. Just because everybody schedules 30 minutes for an ortho check, that doesn't mean you can do that right out of the gate. Don't stress yourself out. Don't stress the patient out. Give yourself a little bit of extra time and back off on the time as you need. But I help set up the office, help organize which operatories are the best. Supplies that you need for treating patients. I've had a couple of doctors in the Tennessee area ask me to come to their office once a month for about 6 months, and I went on an ortho day. And they wanted to make sure that their staff, and it was a pretty large office, but they were wanting to make sure their staff was flowing and doing ortho to the best of their abilities and making sure their patients were getting quality care. And so I customize what every office needs, because every office is special in their own way. They're very unique.
Different personalities as well.
Absolutely. And so when they go, well, what do you do? Well, it's like, well, what do you need? We will do whatever it takes to make ortho successful in your practice, whether it's Dr. Williams helping you with your treatment and diagnosing and your cases, and me helping with your assistants and his management team helping with insurance filing and scheduling. And then, like you mentioned, the AOS, just the support of being an active AOS member, having all of those steps in place is just a great recipe for success.
Absolutely.
And so We truly want these doctors to succeed, and it's something they can do and they should be doing.
Right, absolutely. And once you give them the knowledge, they can do that. Well,
Absolutely.
if any of these doctors are out there that need your services, can they contact you, Susan?
They can go to my website, which is susancoffeyconsulting.com. And it's Coffey, so like the drink, but not spelled the same. And they can also reach me through the AOS, and the AOS will put them in contact with me if they have any questions.
Well, for my last question to you is, if you gave one piece of advice to a doctor or to assistant or hygienist about orthodontics, what would it be?
We touched on this just a little bit earlier, but it's to just do it. Just get in there and do it, because you can do it. You should be doing it. It gives your patients the all-around service they need. When you're incorporating your general practice, your endo, your crowns, along with ortho, all of that is being done by the same doctor treatment planning them.
You'll be a better dentist as a result of it, because sometimes a tooth needs to be moved to get it into the right position to be able to put a veneer, to be able to put a crown on, to upright
Absolutely.
molars, to do all the things that are necessary to get the case set up so that you have the best restorative result. So
Absolutely.
Those things are really critical. And in the past, dentists have had to send those patients out to have that done. They now have the opportunity to go to a course and learn how to do these things on a routine basis in their practices, and not have
Absolutely.
to send out to other people to and reap the benefits financially as well. I mean, that's really something that's part of the business of orthodontics, and I preach that all the time. This
Absolutely.
is a business. There's no sense in going to work every day and not make a dollar doing what you've been trained to do for many, many years. Susan
Yes,
Coffey, this has been very interesting. I've really enjoyed talking to you about this.
Well, thank you for having me.
I've known you for years, and through David and through Brad, and I really think that this was going to be a very, very interesting podcast to a lot of our members. This thing goes out to almost 100 countries and throughout the world, and so there's going to be a lot of people listening to you on this podcast, and I want to thank you so much for participating.
Well, thank you, and thank you for the success of the podcast. I think it's a great thing that you're doing.
Well, great. Thank you, and good night.
Good night.
This is your host, Dr. Ed Gonzalez. I want to thank you for listening to Orthodontic Smiles today. If you enjoyed our broadcast, please click the subscribe button. We'll be in touch with you in the future about our further broadcasts. Thanks for listening.